Hi there and welcome to Living Well. I'm your host, Dr. Peggy Malone. On today's episode, we're going to talk about something that's very important to all of us, and that is the health of your heart. Cardiovascular disease, or heart disease, is the #1 killer of Canadians, so it's really important for us to learn as much as we can about this so that we can do the best to prevent it and be as healthy and happy as possible. On today's show, I'm going to be chatting with public health dietitian Cathy MacPherson, as well as Ryan Meloche from Douglas Laboratories and Pure Encapsulations. So make sure you stick around for that. We're going to have really great info about keeping your heart healthier. As always on the show, I want our interaction to be just that, interactive. I want to get to know you and I want to hear what you have to say about the show. You can find me on Facebook at Peggy Malone, or you can head over to Twitter, and my Twitter handle is at Dr. Peggy Malone, or head to the website, www.drpeggymalone.com. At the website, you'll be able to review anything that you might have missed on today's show, and you'll also be able to check out all of the episodes that we've done, which have really great, amazing information on various health and wellness topics. So again, go to www.drpeggymalone.com and check out that great information. While you're at the website, check out my 21-day challenge to better health and wellness. Why is it 21 days? Well, because it takes 21 days to create a new habit and a change of behavior. If you stick with something consistently every day for 21 days, only 3 weeks, chances are you'll have created a new behavior. And in this case, it'll be better health for you. It doesn't cost anything. The only investment I'm going to ask you to make is some time and a commitment that you're actually going to stick with it. Do the strategies and action tips that I'll give you every day for those 21 days. Let's take a journey towards better health together. Find that again at www.drpeggymalone.com. As always at the beginning of the show, we want to get your take on health. On a previous episode, we talked about complementary and alternative healthcare, and specifically we talked about chiropractic and registered massage therapist. Obviously, this is something that's near and dear to my heart, myself being a chiropractor. Here's what some viewers wrote. One viewer wrote, "I love my chiropractor. I had back pain for years and thought I would always have it. I was amazed at the difference that chiropractic care made." Another wrote, "I rely on my massage therapist to keep me moving so that I can keep up with my busy life. Massage is definitely part of my regular health and wellness plan." All right, so today we're talking about heart health. So if there's something that you saw on the show today that you would like to know a little bit more about, or if you have some questions about your cardiovascular well-being, then come on over to Facebook or the website or to Twitter and let me know. After the break, we'll be chatting with public health dietitian Cathy MacPherson. Don't go away, it's going to be really fun. Hi there and welcome back to the show. Joining me now to talk about your heart health is public health dietitian Cathy MacPherson. Welcome to the show.
Thank you. Thank you for having me.
All right, so we're talking about heart health, cardiovascular health. First question I'm going to ask you is, what is cardiovascular disease?
Well, most of us are born with a strong heart, a strong pumping heart and clear arteries designed to last us for 80 or plus years, but very, very few of us get to that age without some degree of cardiovascular disease. And in fact, as you mentioned in the introduction, it's the leading cause of death in Canada, and Elgin and St. Thomas residents are not immune to that. One of the key cardiovascular disease, by the way, is the diseases of the heart and blood vessels. It's a catch-all phrase for that. And one of the most common is atherosclerosis, or hardening of the arteries. And I have this little image here that may help you to get a sense of what is occurring in atherosclerosis. This to the far left is a nice, clear, lovely artery. It's pretty much what you're looking at when you're born. And depending on what lifestyle you have and genetics you have, over the years, these arteries can develop atherosclerotic plaque, which can eventually narrow the artery. And if the artery, as you can see, as it moves towards the right here, as the artery gets especially clogged, it can actually cause a heart attack or a stroke. The very, very good news is, though, that we know that lifestyle choices that you make through food and activity and stress management can slow the progression of atherosclerosis. So living well is the step to keep in mind.
All right, so you mentioned some of the things that will help to prevent cardiovascular disease, just briefly. What are some of the risk factors for cardiovascular disease?
Well, there are many risk factors, and of course, the more risk factors you have, the greater your risk for cardiovascular disease. Some of them we can't control. We don't want to dwell too much on those, but there are certainly many that you do have control over. We'll start with the ones that you don't have control over. Family genetics. If you have a mom, a dad, a brother, or a sister with heart disease, or any of the risk factors for heart disease, then the risk for you having heart disease may be higher. So we can't do anything. We can't choose our parents. So genetics is certainly a factor. The other thing we have no control over is age. As we get older, the risk for cardiovascular disease goes up, of course. For men, it tends to be over 55. For women, over 65, particularly after menopause, when our natural estrogen is going down, and that can protect us against cardiovascular disease. So age. There's certain populations as well, like the Aboriginal population or South Asian population, that is a risk factor that we can't control, as well as diabetes. Diabetes is a huge risk factor for heart disease, and there's a certain amount of genetics there, but also there are some lifestyle choices that you can make that can delay the onset and certainly manage it when you do get it. So those are the risk factors that we have no control over. The risk factors we do have control over are weight. Maintaining the healthiest body weight that we're capable of achieving is so important to the prevention of cardiovascular disease. Keeping healthy blood fats is also very important. We're going to talk quite a bit about that in just a few minutes. Keeping healthy blood pressure, choosing to be active, not smoking. These are risk factors that we do have some control over. So those are the ones that we really want to focus on.
Okay, great. You had mentioned in your little diagram there, as the artery is occluded, it could lead to a heart attack. I think it's really important for people to understand what are some of the warning signs of heart attack.
Okay, it is really important to understand, because if you do feel these symptoms, it's so key to get immediate help, because it can certainly reduce the damage that can occur, and of course the worst case scenario of death. So really listening to the possible signs and symptoms of heart attack. So one of the key ones is pain or discomfort. It's been described as a crushing pain or a squeezing pain or a burning. It tends to be through the chest, up. It could be through the throat, the jaw, shoulder, down the arm, through the back. Often described as a pain in the thumb as well. So that kind of pain. Also, shortness of breath is something that the individual might experience if they're having a heart attack. Also really common is just a overwhelming fear, anxiety, and stress, because you know something's really, really wrong, and often it's denial. Oh, it couldn't possibly be me. Oh, I'm too young. I don't have you go through all the reasons why it wouldn't be you. And a final one that I can think of off the top is clammy, sweaty feeling. So those are the most common signs and symptoms of heart attack.
Yeah, and what I often tell my patients on that subject is, if you're having those symptoms and you're thinking it may or may not be, sometimes people just don't go to the hospital. They just lay down. I tell people often that it's better to be embarrassed because it's nothing than to obviously head to the worst case scenario. So head to the hospital if you're having those symptoms, definitely.
That's so true. People often do just ignore the symptoms and lay down, and that's, don't be afraid to say, it's something else. You just have indigestion. Rule it out. Get in there and find out. Yeah.
All right, you mentioned being overweight or obese as a risk for heart disease. Tell us a little bit about that.
Yes, obesity or overweight is an independent risk for cardiovascular disease. The correlation has been shown over and over again in the research between being overweight or obese and cardiovascular disease, especially if you've got a lot of those other uncontrolled risk factors. So it is certainly a key preventative thing to work towards a healthier body weight. We usually think of healthy body weight by looking at the body mass index. It's kind of complicated. Going to the Heart and Stroke Foundation website is a great way. They've got a BMI calculator in there, or you can contact the health unit as well, and we can set you up with information to figure out your body mass index. And essentially 25, a body mass index or 25 and above increases your risk. But even more important is the shape, where you deposit the body fat. So individuals that tend to be more an apple shape, that is, they have more of the fat around the central, the waist around the center, as opposed to pear, where the weight is around the hips and thighs. That central adiposity really increases the risk for cardiovascular disease. So men, if your waist is above about 40 inches, 102 centimeters, women above 35 inches, about 88 centimeters, then it's time to address your weight. But the one thing I want to say about healthy body weights is, you can look at the waist circumference, you can look at the BMI, but the bottom line is we know that if you reduce your weight by 5 to 10% from what you are right now, if your doctor says, oh, you're showing a lot of risk factors for cardiovascular disease, reducing your weight by even 5 to 10% can reduce your risk of cardiovascular disease. So if you weigh 200 pounds, if you get down 10 to 20 pounds, you can reduce your risk. So try not to get too hung up on the BMI and the numbers. Think about that, getting that 10 to 15% body weight down and permanently down improves your odds.
Okay. You mentioned fats in the blood as a risk factor. Can you give us some ideas on how to keep our dietary fats a little bit more healthy?
Okay. To do that, in a way, you have to really understand the different types of fat in the blood. There's HDL cholesterol and there's LDL cholesterol, and I'm sure many people have heard of those. HDL cholesterol, or high density lipoproteins, I think of H as happy. They're the good ones. And HDL it's the type of cholesterol that clears the cholesterol from the blood, takes it to the liver, where the body gets rid of it. So it's almost like a sweeper in that artery. It cleans and clears the artery. So you want your HDL cholesterol in your blood high. The not so desirable one is called low density lipoprotein, or LDL cholesterol, and I think of L as lousy. You don't want this stuff. You want to have it as low as possible in your bloodstream to protect you against heart disease. So low density lipoproteins, they're the ones that tend to cause plaque to accumulate on the artery walls and add to the narrowing. So how do we affect the HDL and LDL with diet? Well, the HDL, it's affected by a lot of lifestyle features. For example, being overweight, having too much trans fat in your diet is also a major contributor to the LDL, or HDL. The LDL, on the other hand, it's affected by saturated fat and trans fat as well. So really, really want to be aware of how much saturated and trans fat you have. Saturated fat is from more firm fats. And I think we're almost out of time.
We are almost out of time. This is a really important topic, so definitely head to the website after the show, because we're going to make sure that we get all the information there to make sure that you get all that across. If somebody wants more information, how can they contact you, Cathy?
They can contact me directly, because I was just getting started. They can contact me by checking out our, you can email me directly if you'd like, MacPherson at elginhealth.on.ca, or you can call me directly, 519-631-3159, extension 251, and I've got lots more of information that I'd be happy to share with you at that time.
Oh, okay, great. Thanks so much for being with us.
Okay, thank
All right,
you.
check out that information on the website, because we will have lots more from Cathy there. Let's head over to our health and wellness action tip of the day. Hi there, and welcome to today's health and wellness action step. Today we're talking about heart health. And one of the things you want to do to help your heart to be healthier is to cut dangerous saturated fats out of your diet. Now, here's where we get into some problems. A lot of times when people hear that, they cut all fats out of their diet. And it's really important to know that there are certain fats that you should be eating. For example, omega-3 fatty acids are really, really great for your heart health. So you'll find those in avocados, in fish, in nuts, in other foods as well. So making sure that you're cutting out dangerous fats and not the really great fats that you need for good heart health. A good example of this is when you have yogurt from the grocery store and you want to cut down some fat, so you'll buy a lower fat version. what'll happen is that manufacturer of that product will add more sugar to get away from the fact that there's a lot of fat in it. Now what happens with this is your body, when you put too much sugar in it, your liver will take some of that sugar and it will turn it into more triglycerides or fattiness in your body, which will increase your risk for heart problems. So trading sugar for fat isn't good either, which is why you want to make sure that you're making good choices about fats. Cut out dangerous fats, decrease the amount of sugar that you have in your body, and you'll be on your way to better heart health. We'll see you next time for another action tip.